Hi, everyone, and welcome to the Optimizing Healthcare Strategy and Equity with Location Intelligence and Demographics webinar. My name is Robbie Deming, and I work on the media team at Esri. This webinar is the second part of the Health Information Technology webinar series. We'll be sharing some information about the last webinar in the series later on during this session. You've all joined the webinar in listen-only mode, which means your microphones are muted for the duration of the webinar. That said, we absolutely want to hear from you and encourage you to submit questions into the chat at any point during the webinar. We will have a live Q&A at the end of today's session, and we'll do our best to address submitted questions. This session is being recorded and will be sent to you shortly after the webinar is completed. We'll share a survey at the end where you can provide your feedback on this session. If you can spare a few minutes, we would really appreciate your perspective. I mentioned that this webinar is part of a series of webinars relating to health information technology. We have one more webinar scheduled for June that will focus on driving healthcare innovation with location intelligence. Here's a quick rundown of today's webinar. Dr. Este Geraghty will kick things off with a few comments before Kymberli Fieux discusses improving health equity with location intelligence. Daniel Probasco from Amyris and Phil Lanzafame from Sentara Healthcare will share their respective stories before participating in a short panel discussion and Q&A with Jing Wu. With that, I'd like to hand it off to Dr. Geraghty.
Thanks, Robbie. I appreciate that. So good day, everybody. I think that there's really tremendous power in data, especially the breadth of demographic data that's out there. We use it to provide population level denominators for rates of disease. We stratify our analyses by key demographic indicators like age cohorts or gender, and we access population level market data to help us make strategic decisions, perform marketing outreach, and address the social determinants of health. Now, maybe you take it for granted, but today you're going to see how demographic data drives conversations of health equity, supports market sizing and planning decisions, and informs the social and cultural aspects of patient care. To get us started, if you will, I'd like to provide two examples of the power of demographic data that I've seen in my time at Esri. And I thought I'd begin with the prevalent topic of the day, COVID-19. Now, as you all know, one key to success in reopening our economy in the face of the pandemic is to ensure adequate testing resources across the country. But where should we put those testing locations? We don't simply place them at equal intervals, kind of like a checkerboard across our communities. No, we want to ensure that they're placed in a way that supports demand and need. So by using demographic data variables that are indicative of those demand and need characteristics, things like the individual susceptibility to disease risk, socioeconomic risk, transmission risk, and exposure risk, we can prioritize where testing sites should be placed to ensure fair access to testing. In a second, non-COVID example, we worked with a state that wanted to improve their foster care system by recruiting more foster families and achieving more positive experiences for foster youth. Now, their process was to analyze their current foster homes using a set of key metrics that they had to define success. Things like they had fewer complaints. Then they geocoded those that they deemed to be most successful. Now, based on neighborhood characteristics for the best foster homes, they used marketing segmentation data to find the dominant market segments. Now, once they knew those dominant segments, then find other places in the state where those same market segment groups live and then message to them using the information channels that they knew they prefer. So in this case, that was using paper placemats that suggested, would you like to become a foster family, and putting them in their favorite restaurants. Now the result? Well, they were able to achieve their goal of providing more foster homes that did actually have better outcomes for young people. So demographic data has tremendous power if you know how to use it. So today you're going to hear from several people who have combined that population level data with location intelligence to inform real actions that make a real difference. So Robbie, I'll hand it back to you.
Thanks so much for that intro, Este. Before we get started, we have a quick poll that we'd like to get your perspectives on. So we're curious to know if you are currently using demographics for any sort of aspect of your health operations. So we'd be curious to know if you're using it for patient care, for market opportunities, or both. Or if you're not using it, that's absolutely okay as well. So we'll go ahead and leave this poll open for just about a minute or so. You can see the votes are coming in. All right, and I'll go ahead and close the poll now and share the results with everyone. So as you can see, it looks like actually quite a few of you are using demographic data for both patient care and market opportunities. And actually, I'm really pleased to see that only 6% of you are not using demographic data at this point. So we'll get back into this a little bit later. We've got one more survey question about obstacles, but I'd now like to hand things off to Kymberli Fieux, who also works on Esri's health team, and she's got a fantastic story to share about improving health equity with location intelligence. Kim, I believe you are all set to go.
Today, I'm going to explore how geography can be an essential tool when looking at health equity in your community. So the fact that where people live and the environments around them has a significant impact on their personal health and outcomes is nothing new. Hippocrates wrote about this in 400 BC. And when we talk about health equity in a way, we're really talking about the result of health inequity. When we have disparities that lead to poorer health outcomes, we can then discover what those disparities are and how they impact the realities of homelessness, the level of poverty in our community, how veterans are treated after they come home from their service. The outcomes are things we can all imagine in our own communities. And there's a force even more powerful than genetics or medical care. And that, like Hippocrates wrote, it's the environments in which we live, work, grow, and play. And those environments strongly influence our personal behaviors. And hey, while our communities can't curb our cravings, they can craft our choices. And given the choice between an apple and an ice cream, I have to say I'll always choose an ice cream. But knowing the apple is available is the first step. And one area that needs to persistent action is addressing the social determinants of health. The World Health Organization defines the SDOH as all the conditions in which people are born, grow, live, work, and age. I think you'll all recognize how important education, economic stability, and health are to you, especially in times like we have right now. So it ends up that your zip code can be even more important than your genetic code when it comes to your lifespan. Just look at this life expectancy map from Chicago. If you're born near the Willis Tower train stop, rather than the Garfield station, just a few train stops away, you can gain an extra 16 years to your lifespan. And that's huge. I'll take 16 years. I'm sure everybody would. So what is GIS and why does it matter here? Well, GIS, or Geographic Information Systems, is a system that lets us visualize, question, analyze, and interpret data to understand relationships, patterns, and trends. It's not really too intimidating or different, since it's actually just like any other information system that you're accustomed to. The only difference is the inclusion of geographic data. And the science of where, which is what we at Esri call it, has advanced tremendously so that we can do things with geography that weren't even possible a few years ago. It all begins with answering the fundamental questions of where. So where are the problems? Where are they changing? Where should we locate resources? And a great start to learning more about that is a tool called a Community Health Needs Assessment, or a CHNA. The CHNAs are done by hospital organizations as well as public health entities, and they help answer those fundamental questions when it comes to achieving health equity in a community, such as what is hurting our community, how can we make a difference, where are the highest impact interventions, where are you going to get the most bang for your buck, and who needs our help the most. And as we talk about connecting GIS to health equity, we can look at the 6 steps that are involved in facilitating a community health needs assessment, as well as a community health improvement plan, which is the next step. I've broken out each step and we'll share some examples from Esri users for each one. So the first step is to work with the data you have and start to plan. As always, you got to get a plan and you have to be organized. So using primary sources of data such as interviews, focus groups, and assessments, combined with secondary sources such as the census data, American Community Survey, and any other sources available to you, you can start to get a picture of who lives in your community, where the gaps are, and how their needs are being met currently. So do you know where your underserved medical areas are? Or where you have health insurance rate disparities or any other kind of disparity? Are your locations for service in the right place? And how far do people have to travel to get there? If there's a high travel burden, they might not come. And lastly, who are the people and what are the common demographics of your community? Do you know what types of jobs they have? What kinds of businesses are there? And what are they most likely to do on a daily basis? In this look at Cook County, they brought it all together. Their population is predominantly white, as you can see in the bottom graph, but you can easily see on the top that their Black community is being the most impacted by COVID-19. So this knowledge can help them begin to develop their operational plan on how to better serve the needs of that community and where to place resources. The next step is to collect new data in real time and begin to make sense of it. So you can do focus groups and interviews, such as we noted in the CHNAs, or you could do surveys in the field, crowdsource with keywords, or manage what is going on in real time. For instance, as your public health entities take temperatures in the field right now during the COVID pandemic, or your employees return to work, a mobile app such as this one can record who is sick, who is well, who is displaying symptoms, all feeding into a dashboard in real time for decision makers to view. And we have many counties across the country doing this right now, using those mobile applications to feed that data in real time, live, right to a dashboard. And in this CHNA from Rancho Cucamonga, California, they learned from the community there were not enough access to fresh and healthy foods, and they felt that they didn't have enough areas that they could really be in nature. They just wanted to get out and feel the ground. And so this led to a change in policy allowing community gardens throughout the city, and they reduced associated fees to make them more accessible. And the top graphic is a slide map where you can, it's a little hard to see here, but on the left, is what it used to look like where there was very little green space. And on the right, they've added a lot more to it to make it available for everyone in the community. The next step is to communicate your findings to lead to buy-in from the community and stakeholders. So during Washington, D.C.'s CHNA, they realized that they really had a city divided by income. The lowest incomes are in gold, the highest in blue, almost totally dividing the city in half. So when you know those baselines and you can see them visualized on a map, it can really help inform the decisions you'll be making about delivering the services and where they need it the most. And once you've gathered your data sources, made some discoveries, you really then need to communicate that out to people. This example of a hub site is a great way to educate people and let them know what you've learned in an interactive method. It's two-way communication. People can follow certain initiatives that they're interested in, and it's a lot more interesting to work with than a report in a binder. And it makes sometimes more complicated data accessible to people in a way that they understand. And then you can share your analysis. For instance, where has need surpassed availability? What can you do to help lighten the load? This analysis of surge and capacity helped in planning where a lack of social distancing might impact bed utilization in Florida. And if you were interested in investing back into the community, you want people to be engaged and understand how you're helping, which is how this dashboard for Providence St. Joseph Health is used to indicate their commitment to their CHNA and the community. So they invest tremendous amounts of money back into the community, and they want to make sure that their investments are doing well, that they're hitting the community in the right place at the right time. And so they use this to work with their partners to ensure that. One of the most important steps is to allocate your resources wisely to the right people, the right place, at the right time. And this is a good example of how to choose COVID-19 testing sites. As Este had mentioned earlier, taking into account where there is demand, figuring out where to place each testing site so that the burden will be equally shared. This also helps ensure that assistance is spread equitably across the community. And a partner of Esri's, Direct Relief, uses GIS to target where certain medical supplies, such as inhalers and other medications, will be needed. They travel all over the world during any type of disaster and lend assistance. So here they used analytics to determine the migration patterns of people who fled from Paradise, California after the wildfires last year. Once they saw that a majority were moving towards Chico, California, they placed their mobile aid unit there to hand out masks, inhalers, and other medical supplies, reaching the most people possible at once. And as always, making sure decision makers are informed in real time is critical to the success of your program. This is a look at the Arizona governor's dashboard. He's able to view everything necessary across all emergency functions in one place, which is constantly being updated in live time. So he comes to work in the morning, he looks at this, everything is there for him. And as you can see in this tab, which is just one from that dashboard, it is all about the COVID-19 pandemic in Arizona, but it gives special attention to the outbreak in the Navajo Nation, which at this point has the highest per capita COVID-19 infection rate in the United States. Many factors are contributing to this, such as lack of electricity, limited access to healthcare, minimal running water, and the lack of protective supplies. So when you look at health equity in a community, they're really being impacted by this pandemic. And of course, you always must educate your citizens, because without their understanding and buy-in, your programs will never be successful. And I think the most recognized dashboard in the world right now might be the Johns Hopkins University coronavirus dashboard. They were the first to get one up and has consistently been recognized. So when I took this first screenshot on January 20th, there were 555 infected and 17 deaths. As of Tuesday, May 26th, when I took the second shot, we're now up to 348,000 deaths and over 5.5 million infected. And of course, just yesterday, we hit over 100,000 deaths in the United States. So this dashboard alone, I think, has made it easier for the public to understand the breadth of this pandemic and see it move across the world in real time. Arkansas recently recognized that there are differences in how COVID affects people with comorbidities. So they added a great page to their dashboard to educate their citizens on what their patients were presenting with. And this could really help educate those who might need to take extra care at this time, such as people with hypertension or diabetes. And I've been following the availability of testing in my community, and it's been really interesting. The first site opened when most cases were coming from people who had traveled to Europe and Asia. It was located in the city near me with the highest per capita income of $85,000 in Indian Wells. As the pandemic progressed, the sites were moved as community spread began to happen. And now most of the testing sites are located in the areas with the lowest per capita incomes in our valley, dominated by migrant farm workers and people who have been considered essential workers that couldn't shelter at home. They didn't have that option. So from the highest income to the lowest, from 85,000 per capita to 9,500, it's a total distance of 19 miles. The last step is always to continually evaluate your progress. So Rancho Cucamonga, California took on a 10-year Healthy Communities project to really try to understand the disparities in their community and address them one by one with community partners and their citizens. And as they tracked their progress, they saw change over time reflected in amazing numbers, such as a drop of 14% in diabetes, 20% in heart disease, and 13% in childhood obesity. This is a return on investment that they should be really proud of, and that program continues to this day. And one way to track progress is also to be able to follow trends in real time, which is demonstrated on this COVID-19 recovery dashboard. If we need to have a certain trend of a decline over 14 days prior to reopening, as we've been watching, we need to know where we stand and if we're going in the right direction. So the green indicates a decrease, red indicates an increase, and will definitely give a community the information they need before reopening. To sum it all up, GIS can help you better understand who lives in your community, what their needs are, and how to help make it a healthier place to live. This graphic on the right from Klamath County, Oregon, I think demonstrates the importance of engaging all aspects of the community, so businesses, government, and your youth, to ensure that your programs are successful and you're reaching all of your citizens. Thank you very much for your time. I'll hand it back over.
Thanks so much, Kymberli. Before we introduce our next speaker, we actually have one last poll for you all. So let me go ahead and push that right now. All right, so this poll looks to get into what are some of the obstacles that you run into in terms of using demographics in your decision making. So if you could take a few moments and let us know which of these most applies to your organization. We're just kind of curious to see what might be stopping you from maybe doing things that you'd like to be doing. All right, and it looks like votes are starting to slow down, so I'll go ahead and share the results with everyone. And so actually it looks like the two biggest barriers right now are privacy concerns, HIPAA compliance, and lack of access to demographics. So those are interesting things to kind of keep in mind. I know that Esri has done some work with some of our partners, and we're very concerned about things like HIPAA compliance. So thanks so much to everyone for sharing that. With this, I'd like to go ahead and introduce our next speaker, who's Daniel Probasco, the Vice President of Strategy and Development at Amyris.
All right. So as he said, I'm Daniel Probasco, Vice President of Strategy and Development with Amyris. I'm going to take you through more of a business application for GIS today. Many of you may not know who Amyris is. That's by design, actually. We're the nation's first largest and most experienced operator of neighborhood hospitals. I say that you probably don't know the Amyris name because our whole business is based on forming joint venture partnerships with major health systems. So in our hospitals, which there are 32 across the country, you'll see our partners brand on everything from the sign on the building to scrubs to name tags. Our specialty really came about 15 years ago. Company is physician founded by ER physicians who all worked in larger campus settings in a centralized kind of healthcare delivery network, and they had a great desire to improve the patient experience. They could see how long wait times, slow throughput, frustrated everyone, the patient including themselves, because they couldn't get to the patients quick enough. So they sort of founded the company, and it's a relatively young company in the healthcare world, only being 15-ish years old. And I think that's important because we were able to really from the ground up utilize technology and tools that companies like Esri provide to really shape our business and how we do things. So that's really what I'm going to focus on today. I'd like to give you a little background about what Amyris does and what a neighborhood hospital is. Many of you probably haven't seen one. What I have on the screen right now are two different neighborhood hospitals in two different markets. Top one is in Dallas-Fort Worth with Baylor Scott & White, and the bottom is Dignity Health from Las Vegas. Neighborhood hospitals are full service, separately licensed acute care hospitals, but they're very, very small. So one of the really primary things that our founders wanted to address was the need to push healthcare out into the community. Now, clearly, from an acute episodic need, you can't necessarily put a 250,000 square foot campus hospital on 100 acres inside of a community. It won't fit. So they needed to scale everything down really, really small. So that's what they did. In each of these pictures, the first floor is the actual hospital. It's made up of approximately 18,000 square feet or so, and two key departments. So of course, the emergency department on one corridor, an inpatient department on the other corridor with shared services down the center. They wanted it to be small so they could locate it within a neighborhood, and that's exactly what we've done. So our partners, as I said, span across the country. When we look at markets, and I'll get into how we do that, we identify, one of the large healthcare systems within the market, and that's who we decide to partner with. So 32 hospitals across the country, 8 partnerships currently, many in the pipeline that will be opening over the next several years. From a delivery standpoint, as I said, our company had the blessing of being able to develop all of our processes and systems with the newest technology. And so from business development, which is what I'm primarily focused on, all the way into operations and IT and human resources, marketing, we operate these neighborhood hospitals really from start to finish, truly from the ground up. So having a little basis for who Amyris is and what we do, now I think I can better describe how we use GIS in 3 key areas. So the ones I'll talk about today are strategic planning and analysis, which is the highest level. If I think about peeling an onion, it's the highest level of analytics that we all do. Next layer is a market analysis. We'll zoom into a market. And then finally, the most micro level, all of the kind of background modeling that occurs in order to accomplish the first 2 bullets. So I'll start with the strategic planning and analysis. And we use the GIS tools listed at the top really in each of these phases. It starts with our own patients. So we have millions of patients, very robust operation, and in order to develop a strategic framework or conduct a market analysis, we need to understand who are our core patients at the beginning. So it starts with planning and analysis. We evaluate our existing operations. We geocode all of our patients that come through the door. We tag them with a tapestry segment, and that goes into many of our different analyses, not just for marketing programs, but also when we're looking forward into developing a new market, we leverage our existing data and analytics to decide where to locate new locations. From there, we develop a strategic framework. So a strategic framework is at the highest level. Again, we use a lot of the tools that Esri offers here at the state and market level to define different demographics and psychographic variables that are attractive to our business model. Once we've done that, we'll overlay it with a look at what partners are in markets that look attractive to us, and then we'll identify which of those we really want to pursue to form a joint venture business with. That's when we get into the market analysis phase. In the market analysis phase, I'll get into a little more detail on the next page. Still at a 30,000 foot level, but it's a much more granular analysis, and it tells us what portions of a market we would be most interested in developing a neighborhood hospital. That then flows into our real estate group. We give them an assignment, and they will tell us what's available, and from there we'll run multiple sites at once from a modeling perspective to give us a feel for each location, how it will perform from a volume and payer mix and financial standpoint. And then it's a cycle. So at the end, so we've done all this work from strategic development, market analytics, finding a partner, developing the real estate, building the location, opening the doors, and now we're back to planning and analysis. So it's a consistent and constant feedback loop where as we open new markets and new locations, we feed those new patients into our process to continually update and analyze all of our metrics. So let me talk about the market analysis piece. Now this is a summary. It's a very brief summary on one page. Typically, when we conduct this full market analysis, it's 30 or so pages. It includes a lot of other detail with our partner. But at this level, I'd like to describe really the key tools that we use from a GIS perspective that will give us a good feel for each market. So the pictures on the side really are pieces of the puzzle. Using our ArcGIS desktop and business analyst tools, we develop really two key things. So one is a heat map. You're probably most familiar with the heat map. So we develop a BDS layer for each of the variables that are attractive to us, demographic and psychographic variables. We display them on a heat map, and we layer them together. That's why I have this titled as a 30,000-foot layer cake. So if you think about it as layers of data, each layer being one variable from a market perspective, we'll identify individually portions of the market that look attractive to us, and then we layer those on top. And when we're finished, there should be several areas across a given geography where many of the variables line up. And then those are the portions of the market that will then pursue the next step, getting into real estate development. The one other factor outside of heat maps that we look at are dot density maps. So I mentioned that we analyze our own patients in our existing markets and tag them with tapestry segmentation to really understand who they are. We do the same thing when we enter a new market. So we will acquire patient level data from a prospective partner, and we'll use that data for a couple of different things. The main thing at this stage is to identify who are its really key patients that they're serving. And so we'll do the same thing. We geocode them, we tag them with tapestry segments, and we run the same segmentation analysis that we would for our existing patients. And that gives us a good feel for who they're serving in the market and what patients really identify with their brand the most, and will help us identify the optimal locations for new development. So I called this level of the market analysis my objective view. It's purely data-driven. We use a lot of different Esri tools to get us to this stage and really to complete this stage. I'll take this to our partner, and the one thing that's lacking is our partner strategy. And so I'll provide this objective view. My prospective partner will then provide me with, well, here's my strategic view of the market. In many cases, our partner will have differing strategies. Some are very defensive oriented. They want to protect the market share they have in a given geography and aren't very interested in growing outside the geography. Others are more interested in growing their business, and then that's where we would fit in. So we marry those two things together: the strategic view of our partner with the data objective view that the analysis tools provide us. From there, we develop a very solid, strong distribution plan for the joint venture to then pursue. And so the last piece is, what is the modeling I'm really talking about, and how do we look at it in both a forward-looking view as well as validation and a backward-looking view. So what I've put on the page here is our Dallas market. We're partnered with Baylor Scott & White here. The polygons you see in the red color are 12-minute drive times around our existing locations. So we use 12 minutes. It sounds like an odd number. It is actually the average patient-derived service area for all of our locations. So it's really the basis when we're extracting data to run analyses. So as I said, these are existing locations. And this really is what we use to develop all of our models. So we extract data from here. We look at what variables coincide with a solid business unit. So we develop a proprietary volume and paramix model. That's what I have displayed in the top right table. It is outside of the Esri platform, and it's just in Excel. But what it does is it gives us a good feel for how a given unit would perform in the future state. So we can literally, by using the Business Analyst Online tool, put any number of pins on the page, extract data, and run it through the model in a matter of minutes to give us an opinion on how a given location would perform. So as a look back, we kind of flip things around and say, well, I want to evaluate how my model is doing. And so again, I run the same model using our existing locations, run it through that the volume model, and I can then determine this bottom right graph scatter plot based on my modeled volume and my actual patient visits of a mature site, how well does my model perform? And you can see it actually performs pretty well. Keeping in mind that the analysis for a new location occurs day one, well, its doors won't open for 2 or 3 years. And so we're taking that very forward-looking view. So from there, if you think back to the process diagram, we've opened a new market, we extract data again, we have new patients coming in, that feeds back into our volume model in a continuous loop. So that's all I have for you today. I appreciate you listening to my bit. Hopefully we'll have some good questions later on, and I'll throw it back to you.
Awesome. Thank you so much, Daniel. It's really cool to see how you're using the data to guide your decisions about how to operate in each market. Next up, we have Phil Lanzafame, who is the Director of Knowledge Solutions at Sentara Healthcare.
Thank you, everyone. Hello, good afternoon, good morning. And so we'll get started here with a theme that I think is appropriate for the conditions we're living under right now that's been around for a while, is think globally and act locally. And the reason I picked that is I think that the understanding of what's happening at the macro level, we have to be able to bring down to the local level in our communities and our systems and understand what the dynamics are and how we can relate to these. The ability to describe external phenomena such as weather, distance, relationships, demographics, political boundaries, transportation are the strengths to distinguish location intelligence from simply looking at a spreadsheet. The areas of demographics, logistics, environmental, I think are 3 areas that are germane to all healthcare organizations on a larger scale. While these are not mutually exclusive, they're dependent on each other, and understanding the components of patient care, of supplies, home health, couriers, and then with the growing issue of environmental, of climate change, the growing pandemics, and then how do we deal with those, not just internally, but with emergency management, with first responders and other components. So here's a profile of Sentara. We're an integrated healthcare system. We're located primarily in southeastern Virginia and North Carolina. 12 hospitals. We have a health plan with roughly 700,000 members. The takeaway I want you to come away with is there's a lot of people on a lot of roles and a lot of moving parts to take care of. So there's a lot of variation and a lot of opportunity to use GIS components in our business and in how we take care of our communities. So to drill down on that, I made this little map that illustrates some of the components and some of our unique challenges Sentara has within the demographics of our areas. So if you're not familiar with this area, this is called Hampton Roads. It's 6 contiguous cities. Our claim to fame is the world's largest naval base, Norfolk Naval Base. You may be familiar with Virginia Beach, but it's also a very vulnerable area because we're based upon the Chesapeake Bay and the Atlantic Ocean. So if you notice, a lot of our sites, our hospitals are on tidal water. And that brings up a whole different issues that we'll get into in just a moment on environmental and transportation, so many things. So the other thing, but you don't see here in this environment, is there's a lot of bridges, roads, tunnels that connect these cities. And these are also vulnerable. They close, there's accidents. There's all kinds of issues in maintaining the transportation flow and so forth, evacuations and whatnot. So we have some of those elements that we saw in the previous slide on logistics and how we get supplies, how we move things around. And as we move up further north here, we have a facility up in the Woodbridge area, which is on the metropolitan Washington, D.C. area. So when you get up here, it's not only on the water, it's a totally different demographic, ethnicity, political culture, all kinds of things that affect the behavior of the patients and transportation. And then moving out on the west, we have 2 facilities that if you didn't look at it geospatially, you couldn't tell that there's a mountain range between those, the Blue Ridge Mountains. These are both university towns. The only connectivity is between this highway here. And they both have unique aspects to how they behave and their population. So when we get into population health and social determinants, you have to include all these variables along with the transportation, the topography, the weather, and the things we discussed. And then we have one out in the rural areas that has another issues. It's by itself, and so there's all kinds of things that need to be taken care of. So you see, geospatial works on many levels in this context. So I think everyone is aware it's not just healthcare, but as you just saw in the previous visual, that global warming and flooding and everything that goes along with that is going to be a concern. This is from the local paper this year, that we could have a rise of 1.7 feet by 2050. Well, 30 years is not that long in the concept of things to get prepared to start dealing with issues now. What we've been doing is bringing in the FEMA flood maps and overlaying those with our patient populations, employees, and locations to better understand how this may work and get a perspective on this. So it's not only the logistical part and the global warming, but we don't know what diseases are going to be associated with pathogens, what components. And the other thing that exacerbates this is we're in a tornado, or actually a hurricane area, and there's 2 storms off the coast now that are coming our way that could bring a lot of rain. So there's other things, and then what happens if we have the cumulative effect of a hurricane, flooding, and the coronavirus, that we have to do sheltering in place and shelters for people and evacuations. So those are concerns for the organization, for our community, and the things that we're looking at for geospatially to give us some insight into. So I'm going to show you a couple of things we're working on just to illustrate some of the dynamics. This serves a couple purposes. You can see by the data, it's several weeks old, but we're leveraging the popularity of the Johns Hopkins dashboard, and we localized it. And so there's a couple things that this illustrates. One is the data on the right and left is real-time data, not real-time, but it's refreshed daily. Every 6 hours, it comes directly from our Clarity EMR data. So that gets refreshed every time the data is refreshed, and that's connected to the graphs that are below it that shows the trending maps, and it'll illustrate what's happening. So the left side are cases by cities that we have facilities in, and so that gives you an idea of what's going on in the city. And on the right side is how many are tested positive by what facility, and again, there's an aggregate graph that shows the trend over the days. And so I'll take this a little further, because we also wanted to show how we can incorporate the other Esri tools, and not just raw data, but exemplify how we can start understanding the community events. So what you see here is using the business analyst and the COVID planning report that's linked to the city on the left. So now that we're starting to get people, not just the data, but regarding getting them to think geospatially, that there's more there than just raw numbers. And healthcare is very good at dashboards and numerical type things, analytics and so forth. But this is another dimension, that there's real people, there's real community, and there's real variables within those communities. So that's one area. The other one was we included is the tapestry data, and like Daniel said, all of our patient data, employee data, and physician data is geocoded at the source. And so that's another thing. We have a pipeline that geocodes it on the fly. It can bring this data in, and it can present this. So this was a joint venture between our GIS analyst, our data folks, and engineering. So it was a good exercise. The first one's always the hardest, but now we got it down. I think there's a lot of opportunity to build these kind of dynamic dashboards. This is something we're in the process of doing, and it's mapping infusion patients to where they receive their treatment. And what's unique about this is we've never looked at it in the sense of not just the patient where they live in relationship, but what treatments are they receiving, how often they receive it, their age, how far they're driving. You can see there's a number of tabs up here, from a buffer analysis, drive time analysis, and then there's a self-service filtering. So it gives us an opportunity to understand, how do we best serve our patients? How do we look at the severity of the patient? Should an oncology patient drive a certain distance versus somebody that receives episodic? Mapping it to the referring physicians, a number of different variables that really changes understanding of what our patient distribution is, and of course the input and the resources we have available to serve these patients. Going back to some of the other things, though, if one of these systems should close due to flooding or any of the other environmental concepts, then we have an insight into where we can reassign people what their acuity is, and interventions of home health or other services that we may be able to provide. So finally, going back to the whole social determinant type thing, earlier this year it was announced that Sentara has committed a $100 million partnership to understanding and interventions in our communities to support the social determinants of health. And this is really critical. I think everyone is kind of coming to this realization, 60–70% of how we live our lives is not in the EMR. And these are attributes that we really need to understand about the patient in relationship to food, to health, crime, other things that are associated with that. So these are the kind of things we're working on and developing. There's a lot of targets. We are talking to these people actively right now. The group in Sentara that's working on this project about how we're going to apply geospatial technology to this, which is very exciting to be leveraging and following up on something of this magnitude. So that's my presentation. Thank you very much for your time. If you ever like to contact me, you're welcome to. If you're following What 3 Words, you can see my office at Rapid Misty Change. So thank you. Have a great day.
Thanks so much, Phil. It's really inspiring to see the strides Sentara is making. I'd now like to bring back Daniel and introduce my colleague, Jing Wu, who works on the health team at Esri as well. Jing has some questions for both of you. Jing, go ahead and take it away.
Hi, everyone. Well, first off, thank you, Daniel and Phil, for your incredible presentations. It's always so inspiring to see how different health systems and teams are using GIS to forward healthcare. So with that being said, Daniel, I have a question for you first off. I wanted to ask you, what are the biggest challenges that hospitals and health systems are facing at this moment that you feel that GIS could help solve?
Yeah, I think we've all kind of demonstrated that, GIS, there's a lot of tools out there. Again, I kind of commented my company, we were lucky being a young company that we didn't have to redo a system. We were building it from the ground up. And so we were able to use GIS at the forefront. So I feel like, my biggest challenge when I'm looking for new markets to go into is really the regulatory environment. It's not so much, any barriers from GIS. GIS solves problems for me. What I see when I'm looking at new markets, there's a lot of big markets, big states, lots of population where, lots of underserved communities where, healthcare hasn't been able to grow with demographics. And so it's really the regulatory environment, from my perspective, that causes me the greatest barriers. I won't beat on it too hard, but the, certain CON laws that certainly create some issues with not just me trying to grow a business into a new market, but existing healthcare providers where if they want to add a single bed in a given market, they have to go through a whole process. And that's an issue when we're dealing with things like COVID, where, the status quo might be just sufficient, but then when you have this, buildup of a pandemic, you wind up with severe bed shortages. So I would say, GIS is a solution for me, and my biggest barrier is probably the regulatory environment.
Okay, well, folks that are tuning in, I'm sure this is something that you might come across. And for folks who are in the regulation and policy space, this is an opportunity to hear about some of the challenges that health systems are facing that would help them increase access to care for their patients. So I think that was really insightful. Thank you so much, Daniel. Phil, on a similar token, Daniel kind of talked about, building out new spaces, access to care, and Sentara is doing a really great job of, really experimenting with how do we use location as part of our strategy, taking the demographics, looking at the data. So if there are other health systems out there who kind of want to set up something similar, what advice would you give based upon your experience?
Start small, build your team, build some infrastructure, evangelize it, get people engaged, and you'll start building success.
Can you tell us a little bit more about how Sentara started off?
Yeah, it's been organic. I work in the data services IT department, and several years ago I took a free class that was offered by Esri and had access to the program. I was very impressed. We bought a license, brought an intern in, started aggregating data, built a strategy around it in a platform. So Stephen's now a grad student in GIS, and I just finished my certificate. We have a developer, we have some data people working on it. So we're cooking it into the organization now, and are in a position where we can start developing products across the organization.
Yeah, I think that really connects to your first initial advice about starting small, right? Like it started off with you taking a course, sort of seeing, what the possibilities are. And, I'm actually a pharmacist by my background, and I entered into GIS in a very similar way. I was tasked by an orthopedic surgeon to map their trauma mortality patients, didn't know how to do it, looked up online. How do you do this kind of analytics? And next thing you know, I'm just like, holy smokes, location is part of health outcomes, and this is how you do it. This is how you get the insights into mobilizing this kind of information. So I think that's really powerful. And also for all those GIS students and interns out there, do you hear that? Pick up with a hospital, and you can make a world of difference in building out their footprint. So thanks so much, Phil, for sharing that information. So then I guess just to wrap up this portion of the panel, I wanted to ask both of you the same question. So Daniel, I'll start off with you. Now that everyone tuning in kind of gets a feel of what you've been doing with GIS, what do you think in general would help advance the health industry from a geospatial perspective?
Yeah, I think from a geospatial perspective, as Phil said, starting small and building out, my company was small, and so we were able to do that from the ground up. It, just like he said, it was very organic. I think it's a new thing for many health systems, and that's why they approach us in developing new markets. And, going slow, it's a complex package, and, bringing in the right experts is important. As Phil said, I'll just lean on everything he said. Start small, bring in the right experts, build out the team, and evangelize. It does take, it's a new way to look at data geospatially. And so in older legacy systems, there may be some resistance to change. But again, I think, if you have a strong leadership, start small, bring in the right talent, it'll be embraced across the organization.
Yeah, definitely. I mean, you showed it in your presentation, right? Like just the footprint of how much Amyris is able to grow. It's really inspiring, that whole concept of micro hospitals. It's all about how can we increase access to care for our patients and improve health outcomes. And there you go. Phil, then I also ask you the same question. How can we advance the health industry using GIS?
Well, healthcare, as Daniel said, is very regulatory based and very, very objective data based, meaning standards and benchmarks and peer reviews and so forth. So as these call it attributes of where the patient lives and social demographics, and how far should Daniel mentioned 12-minute drive, how far should a oncology patient drive for a therapy? What happens, what are components, from a heart transplant that lives in a flood zone? How do we deal with those? How do we track those? So physicians and the caregivers and case managers, whatever, can take those consideration into their care. And those are not, red light, green lights. Those are kind of subjective in the sense of how we can build this. If you read the literature and the ONC and the standards they're trying to put out there is how do you build those without confusing and taking physicians' time, healthcare time, adding these attributes and still adding value to the process. So I think melding these together with, like what I was trying to illustrate here, the structured data with the community information is probably a way to, kind of assimilate these into the decision process.
Wow, that's an incredible, I'm just, thinking here about how you just talked about the workflow process and how you can use all this information to be, I guess, more strategic in how you use people's time and just how you make decisions. So I appreciate you both for your expertise and sharing what you all are doing. I'm now going to kick it over back to my colleague, Robbie, but thank you so much for taking the time to serve on this panel.
Thank you. Appreciate it.
Thank you, Jing.
Thanks so much, Jing. I think we are pretty much at time. So we did have a couple questions come in. I don't know that we're going to get a chance to address them on the broadcast, but we will follow up via email. Daniel and Phil, there were a couple of focused questions for both of you. So we'll make sure to follow up after the fact. So I'd like to thank Phil, Daniel, Jing, Kim, Este, and all of you for joining us today. Once you leave today's webinar, you will receive a survey on the presentation, and we would really appreciate it if you could complete that and provide your feedback. You'll also receive a follow-up email within 24 to 48 hours with a link to view a recording of today's webinar. Our next webinar in the series will take place on June 25th and will feature speakers from IEHP and the Institute for Families and Society at the University of South Carolina. If you'd like to learn more about this webinar, please visit the URL on screen. On behalf of Esri and our presenters, thank you for joining us today and have a great rest of your day.